All right, I know I say this a lot, but this is the most frequently asked question I get from you guys across all of my social media platforms, which is how can I see you or how can I find a menopause doctor? That is what we're going to be talking about in today's video. I want to go over 4 things that you want to look for in a menopause provider, and I'm going to actually walk you through how to do it over on my laptop. So if you're interested in that, stick around. For those of you who don't know me, my name is Dr. Heather Hirsch. I'm the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital, where I see patients on a consultative basis here in Boston, Massachusetts. Now, at the time of this recording, it is spring 2021. The best way for you to see me is to have your first visit with me in the office, and then after that I can do telemedicine. Now, sometimes insurance gets in the way of this, and I have nothing to do with insurance, but I will leave the number to schedule with me in my clinic down below. Now, if you live in Massachusetts, I can see you as your first visit via telemedicine, but for now, those are the general rules about telemedicine and seeing patients outside of Massachusetts. I'm also proud to be faculty at Harvard Medical School, where I have the privilege of teaching medical students to residents, those doctors who are in training, to some of the other practicing physicians, everything that they need to know about midlife and menopause, because education is really lacking, and it's a key thing that I do across all my platforms. If you guys can't see me, I do have an amazing course called The Complete Guide to Menopause. I will link it right here and also in the description bar below. It is a really nice deep dive on everything midlife, menopause, hormone therapy, non-hormonal medications, how to understand your labs, and how to live your best life, including breast health, bone health, sexual health, and more. I also am the host of my very own podcast, Women's Health by Heather Hirsch, where I cover totally different topics than I cover here on YouTube and really get a little bit more personal with you guys about what's going on in my personal life and share some stories from seeing patients on a consultative basis. Also, go ahead and follow me over on Instagram. I'm at hormonehealth.doc and a bunch of my other platforms, which are linked down below. Okay, so what are the 4 traits that you should look for in a menopause provider or a menopause doctor? And how do you go about finding one? Well, the very first thing you can certainly do is start with your own either internal medicine doctor, family medicine doctor, or OBGYN. The very first thing on my list that physician should do is listen. Listening is a huge and vastly important part of my job. If I don't listen to you, I cannot understand what your top priorities are. I cannot really get a grasp on what is bothering you the most. And I also don't know what your inherent biases are in terms of medications, treatment, hormone therapy, or etc. because I am not doing my due diligence by listening to what you are coming in the door with. You really need a physician who is going to listen. And I do think that this is one of the biggest barriers. Now, that's not your fault. That is simply not your fault. And to be totally fair, I think this is a systems problem. I think that the way medicine is run, the way that physicians have to see so many people in a short amount of time, and the stress that is on them doesn't mean that they inherently went into a medicine to be an uncaring physician. It is a systems problem. But if you feel like you are not being listened to, if you feel like your concerns are not being validated, then you need to ask for a physician who specializes either in menopause or in sexual health, or either. Number 2, you want that clinician to be unbiased. Now, what I mean by unbiased is that there is no right or wrong answer for menopause treatment. It's not that we can only use non-hormonal options. In fact, if you watch my channel a lot, you know that I talk a lot about hormone therapy. It doesn't mean that you can only use hormone therapy, and that is the only or right or best answer. You need a clinician who is at the core really unbiased. Now, I'm going to preface this as well as that I do tell my patients at times that we all do have an inherent bias And for example, I will often say, listen, I read about hormone therapy, I teach about hormone therapy, I see patients and talk about hormone therapy every single day. I read all the latest literature and research, and I talk about hormone therapy in my spare time when I'm filming YouTube videos or posting on Instagram. So I do have an inherent bias about how I think hormone therapy is particularly safe and effective. But that does not mean if someone comes to me and while I'm listening to them, it sounds like they don't want to take it, they have a fear that is deeply rooted, they simply just don't want to be taking medications, they want to use X, Y, or Z, it is my job to remain unbiased and help them on the journey that fits them or you. It's not the journey that fits me. That's not going to be consistent for you. That's not going to help you reach any of your health goals. Next, number 3, you want someone who is educated. Now, this is, of course, the tricky part, and it's not because clinicians are not smart. They're wonderfully smart. Again, this is a systems issue in my opinion. It has to do with the way medical education is run. It has to do with the way people pick what topics that medical students and residents are supposed to learn. And really importantly, it depends on what they see as they're going through medical school and as they're going through their residency. And that is why it is so important for me to be teaching those medical students and those residents as they're going through their curriculum. And hopefully that is going to continue, or I will at some point clone myself or make more of me so that this process does continue. But you do want a physician who is educated. You want a physician who understands hormone therapy, the safety and efficacy, how to do it correctly, how to monitor it, and who knows about the side effects. You want someone who also knows non-hormonal medications in case you simply don't want that or you have a contraindication to hormone therapy. And you also want someone who's really knowledgeable about how to interpret your lab work. I have a great video on how to interpret your lab work that I'll link right here. You also want someone who's going to know how to follow you and how to explain to you when to start and stop or how to change your dose. And last characteristic you want to look for, so I believe we're on number 4, is you want someone who is going to pick the right therapy for you. You don't want someone who just copies and pastes, copies and pastes, copies and pastes. I did a whole video on patch versus pill, which I will link right up here as well. It's a great video because I see so many people getting the patch, and I prescribe the patch a lot, but it doesn't mean it's right for every single person. A lot of times when I'm teaching or I'm giving a lecture, my students or those clinicians who are practicing will say, what is your go-to for menopause? The real answer is there shouldn't be a go-to. I don't have a go-to. I have a big file cabinet in my brain of things that I can pick, and it really depends on what the person is telling me, what their symptoms are, what their priorities are, what their medical history is. And so you want someone who you think is actually individualizing this for you, and you really want to also make sure that when they're picking that therapy for you, they are using FDA approved only hormone therapy. This is huge. I did a whole video on this right here about bioidentical hormone therapy, and in that video I discussed differences between FDA approved hormone therapy, which I absolutely stand behind, including bioidentical FDA approved hormone therapy, and hormone therapy that is not FDA approved, and why you need to know the dangers of those and stay away from them. Okay, so what do you do if you are not finding that the clinician that you've gone to can help you from either 1, 2, 3, or 4? They may be not having 1 or 2 of those aspects or all 4. Well, then you need to go to an expert, and your 2 options are a doctor who is NAM certified or has been certified and is a part of ISHWISH. Now, NAM stands for the North American Menopause Society. To be a NAM certified physician, you need to have taken a certification test, and you need to accumulate so many credits per year of menopause education. Now, disclaimer, not all menopause NAMS doctors are exactly the same. We're all humans. We all have little things that we do differently. So even if you're seeing a NAMS doctor, you want to make sure that they are listening to you. You want to make sure that they are unbiased. You want to make sure that they are educated, and you want to make sure that they are picking the right FDA approved option for you. So let me show you how to find a NAMS doctor. Okay, so here is how you are going to look up a North American Menopause Society certified physician. Now, they can also be nurse practitioners as well. You're going to go to, in your browser, menopause.org. I do it all the time, so it comes right up. Once this pulls up, you're going to see a section over on the right-hand side that says for women, and you're going to click Find a Menopause Practitioner. This is going to pull up a nice search bar engine where you can type in your zip code and you can pick how many miles you want to travel. I would actually recommend you just put the most because you certainly might want to have an array of different types of physicians you can look up and then go see. You can put in your state and then click find. All right. Now that you know how to do that, there is another place that I definitely recommend you should look if sexual health, sexual function, pain with intercourse are a really big component of what you are searching for and need help with. And that is someone who is in the ISWISH community or is a provider listed by ISWISH. So let me show you how to find an ISWISH doctor. Great. Now I'm going to show you how to find a clinician who is certified by the International Society for the Study of Women's Sexual Health. So you can actually search ISWISH, ISSWSH, and you're going to come up to their homepage, and it's www.iswish.org, ISSWSH.org, and you're going to just go to home. And as this pulls up, you're going to see a little section here that says find a provider. Go ahead and click on that. And you're going to see the same type of search bars. You can either start by typing in your city, you can start by typing in your country, you can hit your state, and then you can search from there. All right, guys, I hope that was really helpful and super informative because this is consistently asked to me in almost all of my platforms as to how to find a good doctor, how to find a menopause expert. So now you know. Comment below and let me know if that was helpful. Let me know if there's other things that you want to learn about in this space. I am so passionate that you can see a doctor who can really help you in your menopause journey. If it is not me, again, and you do want to see me though, please check out my course. This is a great option too for many women before they go to see a doctor, clinician, or a menopause expert because you are so armed with information. Don't forget also follow me on Instagram, check me out on all my social media platforms down below. Please like and subscribe to this video if you found it really helpful because this community is growing so fast and it is because of you. Thank you guys so much and I'll see you again next week in another video. Bye everyone.